Guys, it's Lisa with livingwithasthma.net, and we are so excited to share with you the very first of our new series, Asthma House Calls, where we get to sit down and talk to some of the very best doctors and health professionals in the asthma field. Today, we're here with Dr. Marc Meth. Hey, Marc.
Hi, Lisa.
Dr. Meth is with Century City Allergy of Los Angeles. He's board certified in allergy and immunology. He teaches at UCLA Medical School. He's been named a rising star in Southern California Superdoctors. He's a board member of the Los Angeles Society of Allergy, Asthma and Clinical Immunology. The list goes on.
I'm
Thanks for
blessing.
being with us, Dr. Meth.
My pleasure.
Now, just to start, for those parents who haven't taken their child to an allergist for asthma, can you tell us just a little bit about what an allergist does and how you fit into a child's asthma plan?
Sure. I would say for most children with asthma, allergists are sort of the specialty that really deals with asthmatics in the pediatric population. With adults, both pulmonary and allergy deal with asthmatics, but for the pediatric population, the allergist sort of deals with asthmatics. And I would say, the most important thing that I do is really get a good history from both the patient and the parent and try to assess what's going on. And that, with some testing that I do, sort of helps establish a treatment plan for that child.
Now, usually when we think about an allergist, we think about allergies. And, we've heard the phrase that allergies and asthma go hand in hand. What is that about?
So sometimes that's true. There are sort of two types of asthma. I mean, there's several types, to be honest with you, types of asthma, but there's allergic asthma and there's non-allergic asthma. And just because so many different things can trigger an individual's asthma. Some of the most common things that we see both in allergic and non-allergic individuals are upper respiratory tract infection, the common cold, okay? And somebody who's predisposed to having asthma, a viral infection or an upper respiratory tract infection usually sets off their asthma. Now, in allergic individuals or allergic kids, they can have allergic triggers as well. For example, if an allergic child and an asthmatic child was allergic to cats and they were exposed to cats, there's a possibility that they could become acutely short of breath or start wheezing.
Are there things that parents can look for if they think their child could have allergic asthma?
Well, they're likely to have other allergic symptoms, okay? They're likely to have allergic either nasal symptoms, sneezing, itchy eyes, itchy nose, nasal congestion. They're also likely to have eye symptoms, itchy eyes, runny, red eyes. That's usually indicative of sort of an allergic child. And when that fits in with the profile of nighttime cough, wheezing, shortness of breath, then you know you have allergies and you probably have allergic asthma.